views. Today it is World Heart Day, 29th of September, and all views of Cypher Health News, they are welcome to the special edition. It is being released on World Heart Day. So in May 2012, world leaders, they committed that by 2025, global mortality from non-communicable diseases will be reduced by 25%. And cardiovascular diseases are accountable for nearly half of all the NCD deaths, making it the world's #1 killer. Created by the World Heart Federation. So World Heart Day that informs people around the globe that CVD, including heart disease and stroke, is the world's leading cause of death, claiming 18.6 million lives each year. And it highlights the action that individuals can take to prevent and control the cardiovascular diseases. It aims to strive action to educate people that by controlling these factors, such as tobacco use, unhealthy diet, and physical inactivity, in fact, at least 80% of the premature deaths from heart disease and stroke can be avoided. So World Heart Day is a global campaign during which individuals, families, communities, and governments around the world participate in activities to take charge of their heart health and that of the others. Through this campaign, the World Heart Federation unites people from all the countries and backgrounds in the fight against CVD burden and inspires and drives international action to encourage heart healthy living across the world. So dear viewers, I am Dr. Rakesh Gupta. I am President of Cypher and former Director of Services Punjab. And I feel honored to have with us an eminent public health expert, Dr. Joanna Cohen, for an informal talk. Welcome, Dr. Joanna. And she is a Ph.D. from University of North Carolina. And as far as Johns Hopkins University is concerned, she has remained since September 2014. She is a professor, Department of Health, Behavior and Society. In 2013, she became Associate Professor, Oncology Center. It is a joint appointment with Johns Hopkins Medicine and other non-Johns Hopkins University professional experiences 22 to 25. She will be member delegate at large Society for Research on Nicotine and Tobacco. And since September 2017, she is scientific advisor and affiliated scientist, Ontario Tobacco Research Unit, University of Toronto. In 2011, she was associate professor, Dalla, Lana School of Public Health, University of Toronto. And 1999 to 2017, she was principal investigator, Ontario Tobacco Research Unit, University of Toronto. And as far as her professional activities are concerned, she has been in a scientific advisory and an expert panel committees, member scientific advisory board for vaping products, Health Canada 2021, and member international advisory board for shaping public health policies to reduce inequalities and harm consortium known as Spectrum 2020. So she is also a member of the California Commercial Tobacco Endgame Advisory Council, organized by the Law and Policy Coordinating Center, a joint initiative of the Public Health Law Center and the American Lung Association. She is also chair California. She has been chair California Tobacco Control Programs Evaluation Task Force in 2019. And she's an expert panel member, evidence-based guidebook on vaping prevention and treatment, substance abuse and mental health services administration in 2019-20. She has been on the editorial board and other peer review activities she has been a journal peer reviewer, in fact. So Addiction 2006-2019, American Journal of Preventive Medicine 1999 and 2002, and American Journal of Public Health for many years. And she has also been deputy editor for tobacco control, June 2016, senior editor tobacco control in 2004 to 2016, editorial board, Canadian Journal of Public Health, 2010 to 2014. And her publications, she has been author for more than 270 articles in referred journals. And some of the important articles are culturally specific health related features on cigarette packs, sold in China. That was published in Tobacco Control. And then there are combinations of electronic nicotine delivery system device and liquid characteristics among the US adults. So this was in addictive behaviors. And there's another article, randomized control trial methods work group of the Center of the Study of Tobacco Products, changes in the nicotine dependence among smokers using e-cigarettes to reduce the cigarette smoking in a randomized control trial, nicotine and tobacco research. And her presentations, she has been invited as a speaker since 2017. So it has been the tobacco industry's misuse of science to weaken evidence-based public health policies, Tobacco Center for Regulatory Science, Yale University. And she has also been a speaker on e-cigarettes, a health promotion strategy that was grand rounds for the Department of Medicine. So ICANN School of Medicine at Mount Sinai. And she has experiences, and she was a speaker for experiences and lessons from countries that have introduced plain packaging. So plain packaging lessons for the next round of implementing countries. So she has been a speaker. And for tobacco, what are the problems and what are the solutions? So 2020 Global Health and Leadership Conference at the Johns Hopkins University. So she has been a research, her research overview has been the major thrust of her research explores factors affecting the context for and the adoption and implementation of public health policies. And it evaluates the beneficial effects and unintended consequences of such policies. To date, the empirical focus of her investigation has been the domain of tobacco control. So you're welcome, Dr. Joanna.
Thank you so much.
So, Dr. Joanna, you're welcome. I can't hear you actually.
Oh, hello. Thank you so much for having me.
Thank you. So can we now start with the informal interview? Actually, it is very informal, but we'd like to know about your education and your journey as a public health specialist, and what factors actually influenced your choice for this profession.
Well, thank you. It's such a pleasure to be with you and talking with all your listeners on World Heart Day. You know, I think like a lot of people who are interested in health and do well in biology and other courses like that in high school, you think, oh, medical school is the career choice for me. So I applied to medical school and did not get accepted. And so at that point, I went to McGill University in Montreal, Canada, because that was my hometown. That's where I was living. That's where I grew up. And did science, focused on physiology, and really enjoyed learning about the body, all the anatomy courses, biochemistry, all of that. Really got excited. And then it was time to figure out what to do next. And in those days, there was no internet. And so you had to go to the university's career office, and they had very big books of all the graduate programs available across the country. So I would just sit there and turn the pages and see, and all of a sudden I turned a page and there was a program, master's program in community health and epidemiology. I don't know what that is. What is epidemiology? I've never heard of that. And I started reading, and it was about health of populations. It's like, wow, this is so exciting. So I applied and luckily was accepted into a master's program at the University of Toronto, also in Canada, to do a master's in community health and epidemiology. And one of my first classes was taught by a public health physician. His name was John Frank. And he just inspired me. He had so much passion for public health, and he taught the, introduction to epidemiology course. And that was it. I was just like, I was just so excited about the thinking and the approaches to prevention and health at a population level. And so I completed that program. Part of that involved a summer placement, and I was able to go to the Caribbean Epidemiology Center in Trinidad, which is in the Caribbean, low and middle income country. It was just very interesting to be there. And they were like the Centers for Disease Control, but for the English speaking Caribbean. And I got to I did a project where I had to look at death certificates, and death certificates there were kept by there was a designated person in the neighborhood who was responsible for birth certificates, death certificates. So I would go to people's houses and look through the certificates and be coding the death certificates. And it was around cardiovascular disease, actually. So it was a really interesting start to actually see, the causes of death and how they were being reported. And finished that up, got to work for a couple of years, and then thought, I guess I should be doing a Ph.D. And then went to the University of North Carolina in the United States. And it was very interesting because I was able to work on a project there as a research assistant on a project funded by Robert Wood Johnson Foundation to look at state legislators, like the actual elected officials' views about tobacco. And this was my first foray into tobacco and tobacco control. And as a research assistant, I would go to these people's state offices and interview them. We had a questionnaire, and I would ask them questions and fill it out. And I remember many of the state legislators in North Carolina, they told me, tobacco is so important to our economy here in North Carolina. Tobacco has put food on the table, shoes on our feet, really important economic engine. And so I think for me, starting out in my career in public health, it was very useful to hear that perspective. Everyone is coming from a different place. And there are farmers, there are people whose livelihood depends on this product, even though from a health perspective, we have far too many, deaths and too much disease from this product as well. So it was very exciting to be involved in that project. And then was able to move on to the University of Toronto, and we applied for money and did a similar project in Canada where we interviewed Canadian legislators about their views on tobacco. Everything just, you just have to be open-minded and see where things take you and who inspires you. And there's a lot of luck involved in the process as well. But I was extremely lucky and was so fortunate to have so many wonderful mentors along the way who got me excited in public health, got me excited into tobacco control, and I was able to learn so much from them.
So that is great. I think it has been a very interesting journey as a public health specialist. Initially, you were at University of Toronto. You did Masters in Health and Community Epidemiology. So that is very interesting. And I think the first thing that changed your mindset was when you interviewed legislatures in tobacco. So I think they have the same questionnaire from the tobacco industry, same arguments by the tobacco industry all over the world. I think they always say that you earn a lot of money as taxes from tobacco. So that was interesting. And may I ask you about the role in tobacco control, your role in tobacco control and managing the newer products at an international level?
Yeah, so I have been so fortunate. I worked at the Ontario Tobacco Research Unit for many years, which is part of the University of Toronto, and was able to focus on research and evaluation capacity building for the province of Ontario. And then in 2010, as you said, came to Johns Hopkins to lead the Institute for Global Tobacco Control. So doing sort of the same things I was doing in Toronto, but more on a global scale. And again, I've just been so fortunate to have so many wonderful colleagues and meet so many people, including yourself. And we were talking over 10 years ago, just so many wonderful people. And I think that's one of the terrific things about working in tobacco control is that there truly is a global community working towards similar goals, working together, supportive of each other. And of course, we have a common enemy, which is the tobacco industry. So I've been able to learn a lot from colleagues in the field, partly in my role as deputy editor for the journal Tobacco Control, because I see, all the papers that people are writing and get to read them and hear what people are doing. So that is so exciting. And at the Institute for Global Tobacco Control, also, we have the opportunity to work with colleagues around the world on research projects, on capacity building efforts. But with respect to products like e-cigarettes, heated tobacco products. We've been involved in a number of projects, but one of the things I want to share with your listeners is that we have a global scan of country policies related to these products. And it's free. Anyone can access it on our website. Our website is globaltobaccocontrol.org. So the Global Tobacco Control is all one word, .org. And if you go to Policy Scan, you can look at e-cigarettes, heated tobacco products, and we also just released a new policy scan on nicotine pouches, which is another product that tobacco companies are marketing very heavily in some countries. I'm not sure if you've seen them in India yet, but I know products like Velo, are certainly in Pakistan and promoted heavily. So our policy scan is really a useful resource because you can search by the policy domains that countries are regulating. So it could be around, the sale of the products. Are there any restrictions on sale? So of course, India bans the sale of these products. So when you look under sale, and you can look at, I think it's 28 countries ban the sale of e-cigarettes, and India is one of those countries. You can look at how the countries are dealing with whether you can use the product in indoor public places, if there are taxes on the products, the amount of marketing restrictions on the products. You can also see how the country classifies the product. So is it classified like a tobacco product or like a consumer product? There are many different ways that countries can classify the products. And you can actually have there are links to the actual policies, so you can look at the wording that other countries have used. So that's a terrific resource for folks to really understand what other countries are doing in terms of regulating and restricting these products.
So it is very interesting that policy scan by the Global Tobacco Control that policy scan has been used by many, including myself. So since we are, as you know, we are holding a ANTS consultation on 8th of October. So we'll be referring to this policy scan. And may I ask you that how many countries have actually comprehensively banned tobacco, this electronic cigarette? You
So,
said 28 countries.
so we have 28 countries, and I can tell you what they are if you want, or you can ask me about certain ones. So 28 currently completely ban the sale of e-cigarettes, and then 10 countries expressly ban the sale of heated tobacco products like IQOS, those kinds of products.
Okay.
And again, India is one of those countries.
Yeah. Actually, I may just share with you that I went to the Johns Hopkins School of Public Health for that leadership training program. And immediately after coming from that, we banned electronic cigarettes in our state. That was in Punjab. That was a long time back, 2013. So we banned it under Drugs and Cosmetic Act. And we could convince Government of India to ban it, pan India in 2019. And I think India is one of the countries which has comprehensively banned electronic cigarettes. So I think the training that helped us a lot.
Yeah, that's an amazing achievement. And, you know how important that is, because the tobacco companies are continuing to try to reverse those decisions because they want to market these products. So I know, that's important, and you have to continue to stay on your toes in all these policy domains. Just because you pass the policies, it doesn't mean the tobacco companies go away. They continue to fight. You have to continue to be on your toes. And I'm so glad that you're hosting the consultation on October 8th, because it's essential, to keep these policies in place.
Yeah. Because they are all, trying to get that act repealed, the vape industry. So that is why I think that consultation is important. And Dr. Joanna, I may just ask you that since you are the senior most tobacco control, one of the senior most tobacco control enthusiasts. So what do you think are the immediate tasks at hand for India to reduce the tobacco burden? Just name a few.
Just a few. Well, for one thing, India has, we have to acknowledge how well India has done because of people like you and all of the, healthcare professionals, advocates who are working hard at the local, state, and country level to implement strong policies. So there is a lot for India to be proud of. One of the amazing things is the health warning labels on tobacco products, one of the biggest in the world, and that is an incredible achievement. There are strong smoke-free policies. However, there are still some loopholes that need to be closed for smoke-free. There's still designated smoking areas allowed. So that's something that can be worked on to remove the ability for venues to have designated smoking areas, because of course they harm the people in them, they harm the servers who enter them. And research that we've been involved with has shown that there's not a lot of compliance with the requirements for the designated smoking areas. They're not following all the rules. I think with the health warning labels, again, India's done a super job, particularly with cigarettes. But when you look at BDs and smokeless tobacco, the implementation of those policies, not so good. It's hard, with BDs when they're wrapped, in a conical shape with newsprint. It's hard to get the 85% warning on the product. And I think one thing that's going to have to be considered is to maybe determine a standard pack shape for BDs and also for smokeless tobacco, so that the health warning label can be placed appropriately on those packs and be visible. With smokeless tobacco in the packets that are sold, some of those packets are so small that first of all, they're very cheap, so that's not good. And secondly, it's too small to see the health warning label. So I think thinking about how to make the health warning label more visible, particularly on smokeless tobacco and BDs, that are so, very prevalent use in India. That's really important. And then again, India's done a super job with like marketing restrictions, reducing tobacco advertising and promotion, not allowing tobacco to be sold in the vicinity of schools.
Yeah.
That being said, we still have to continue to work on implementation. So strong rules, but they're not always followed. And so we have to continue to work towards ensuring that the strong policies that are in place in India are implemented effectively so that we get the public health benefits that are the goal of those policies.
So in fact, I agree with you for everything you have said. In fact, the law is very good, that Cigarette and Other Tobacco Products Act. That is very strong act. I think one of the best acts anywhere in the world, but the implementation is definitely not that good. So implementation of any laws, in fact, that PICA, I told you about the Prohibition of Electronic Cigarette Act. That is also still to, I mean, not to the, our liking. So enforcement is not that good. And that TAPS is very good. I mean, the law is good, and the Victoria health warnings are very good. And I agree that the standard packaging should be there for the smokeless tobacco and the BDs. So that is required. So now I'll ask you about your contributions as a director of IGTC, John Hopkins School of Public Health. I have seen you working as director in 2012 when I was there. What will you like to say about that?
I am just so lucky. This is a dream job for me. I am still so passionate about this work and so excited to start work each and every day. Part of that is that there's a wonderful team at the Institute for Global Tobacco Control, tremendous diverse group of people who bring many skills and their expertise from different disciplines. So it's just wonderful to be able to work with all of them. And as I said previously, that it's wonderful to have colleagues all around the world, whether we're working directly with you or indirectly. With, as part of the global tobacco control movement. It's just so inspiring to hear about people's successes, to share our challenges, to share our strategies that have worked in some places. So I'm super excited. And I think, moving forward, one of the things that excites me is that we're starting to think about what some people are calling the tobacco end game. It's not the best terminology. We have to get better words for it, but really thinking about, this is a deadly product, tobacco products, deadly product. We've known that for a very long time. There's no reason anyone else should get sick or die from using tobacco products. These are not required to live. The causes of death are completely preventable. And we have to be really thinking even more strategically and aggressively to bring an end to the global tobacco epidemic, and starting to think about what conditions need to be in place and how we get there. So I'm very excited to be learning from colleagues who are really spending a lot of time thinking about this and trying to move forward, to really, put all of us out of business so we can move on and deal with other important health problems, and that, we get to finally to the end of the global tobacco epidemic.
So I agree that you have a wonderful team in that IGTC, and you have been doing that capacity building workshops, too many workshops, and the online and offline also. And I've also attended some online trainings also, in addition to that leadership training course. So it's nice to learn about that. And everybody in your team is really passionate about teaching, actually. And many of your alumni now, they are working well in tobacco control all over the world. Yeah. So that is great. So, ma'am, and now I'd like to ask you about your message about that World Heart Day. As we know that tobacco is I think it is one of the most important causes, the preventable risk factors for cardiovascular diseases. So, what is your message?
Yeah, well, I would just encourage all of your viewers, your listeners, and all of us around the world who are interested in health to make sure that we are aware of the deadly effects of tobacco products, that this isn't by chance, because we have tobacco companies who are actively trying to maintain and expand their market and doing everything that they can to do so, and to prevent jurisdictions, whether it's local, state, or at the country level, and even globally, preventing them from taking effective action to prevent these preventable deaths. So we just have to continue to do our work. This is important work. On World Heart Day, of course, we can acknowledge the very important, we are all aware of the importance of the heart as a essential organ for our life, but also, it has all of the societal it's a metaphor for love and spirit and caring. So it's just perfect to think about World Heart Day, both in terms of protecting our heart and our cardiovascular system from the devastating effects of tobacco products, but also putting our heart into the work and continuing to support each other and doing what we can to reduce deaths and disease from tobacco products. And I thank you, Dr. Gupta, for all of your hard work and commitment to this issue, and your commitment for many years in this area.
So thank you, Dr. Joanna. I think it is a very apt message for the World Heart Day. So we need to be knowledgeable about all the risk factors and try to avoid this, especially tobacco, because we are all into tobacco control. So I think that is an important preventable risk factor. So thank you for being with us. Thank you.
Thank you very much.
Thank you.
Hello and welcome to DocPlex's Health Minute. Tata Medical Center Kolkata and IIT Kharagpur have launched a fully annotated relational de-identified cancer image bank named Chhavi. This comprehensive archive of imaging will enable scientists across the globe to freely access patient images and necessary clinical information that can be used for research. A digital calculator has been developed jointly by National University Cancer Institute Singapore and a local artificial intelligence startup to help healthcare workers estimate treatment costs for cancer patients. The calculations are based on the patient's prescribed cancer treatment, residency status, means testing tier, and eligibility for various government schemes, thereby instantly estimating the overall treatment cost for patients. A first-of-its-kind approval was given by the US FDA to sodium thiosulfate injection to reduce the risk of ototoxicity associated with cisplatin in pediatric patients with both localized and non-metastatic solid tumors. The approval was based on safety and efficacy data from 2 randomized phase 3 trials. Incidence of type 1 diabetes is more likely to occur in children and adolescents who have contracted COVID-19 previously as compared to those with other respiratory infections, says a JAMA study. However, any potential causality remains to be established. The study was conducted in patients 18 years and younger. Do you think COVID can trigger the onset of type 1 diabetes in patients? Share your views by commenting below. Today is World Rabies Day, that commemorates the death anniversary of Louis Pasteur since 2007. The theme this year is Rabies, One Health, Zero Deaths, which promotes the concept of togetherness and unity at individual and organizational levels to eliminate rabies. Get expert insights in a cosmetic surgery suite session on endoscopic facial rejuvenation, the next level, today by Professor Dr. Mohan Thomas as a part of our 9th anniversary celebrations. Don't miss it. For the latest medical updates from across the globe, stay tuned to DocPlex's Health Minute. Happy DocPlexing!